of their things, not drawers like that. You'll have a drawer that pulls out. You'll see the pink basin, and then they will have, a pacifier maybe, wipes. They'll have a tiny little thing of Johnson & Johnson's shampoo and soap, and they will have a bristly brush like this, and yeah, basically this is to take the cord clamp off, to cut the cord clamp off, but you don't need that right now. There will also be their own thermometer and their own bulb suction. So you can kind of just teach the mom how to do all these things as you're going through the bath. So, and some of that teaching, like Sue said, you want to do beforehand, because once that baby's crying and stuff, the mom's not even going to hear what you're saying because they're just worried about that crying baby. So talk about all this stuff beforehand. One of the big things when you're doing an assessment or a bath is maintaining thermoregulation. Because like Karen said earlier, when their temperature goes down, things get bad really fast. So you want to keep them warm. You only expose, and this is what you're going to be saying to the mom too, that you're going to only expose the parts that you're working on at the time you're doing that, and every time you get done with one section, you dry it off. Next section, dry off. Next section, dry off. So you're not letting them get cold. So gather all your supplies. So we have a new t-shirt. At the bottom, what they use kind of for like a mattress cover is just a pillowcase. A new one of those. Then they have a little tiny chucks thing that they'll a lot of the times put by their head, because if they spit up, then they just get on that and you don't have to change the pillowcase all the time. And you will have a couple towels and a couple washcloths and some new blankets. Make sure you have a lot of workspace. You'll have the counter in the bathroom. Go in there ahead of time, turn on, there's a heating lamp, turn that on to get the room nice and warm. Get your water running and warm. I'm just going to dump my stuff out here. You'll fill this up. Remember, get it to, they say about 100 degrees. Obviously, you're not going to put a thermometer in there. But make sure it's warm enough for you. Test it on your wrist or your elbow. Make sure it's not too hot. I mean, I like really hot baths, so I wouldn't do as hot as I want, but, nice and warm. Not lukewarm. You want it warm. And get your diaper. You'll need a diaper. So you have all your stuff. And I think that's about it. They have these in here. These are the little bands that you'll see. Mom will have one, Dad will have one, and the baby will have one on each ankle. Blue for boys. Okay, so first we can teach the parent how to take a temperature. And we always do axillary. They used to do rectal. We don't do that anymore. I don't want you perforating their rectum. So you will just expose here, lift the arm up, push the button. When you do it like this, up and down. If you go like this, a lot of the times it sticks out the back because they're so little and it won't be accurate. So always do up and down so that way you're right in that pocket, and then go down. And then if it reads, like let's say it reads 97.3. Well, that's too low, right? So don't just say, oh, it's 97.3. Now we need to put it under the warmer. We need to retake it. And a lot of the times, if you don't push the button and just let it keep going and leave it under there, it'll keep going up from 97.3. And hopefully you can get it higher. But if not, if you've taken it a couple times, it's still even like, let's say it's 97.5. That's too low. So then what we would do is take a warm blanket out of the warmer, wrap the baby up in that, then put the cold ones around it to keep that heat in, and then wait about an hour, retake the temperature. If it's still low, and you would chart all this, then you would have to put the baby under the warmer, and then the baby would have to stay under the warmer for another hour and keep till they can maintain their temperature. So you really don't want the baby to have to do that, because then it interrupts feeding, it interrupts bonding. We just want to keep the baby warm. So you've shown the mom how to take a temperature. Let's see here. You can talk to the mom ahead of time about any kind of rashes that are, the newborn rash is common. And I'm not going to go through all the details in that, because in your green papers there, it says all the details. But talk about rashes, talk about stool habits, the difference if they're breastfeeding or if they're bottle feeding. Talk about immunizations. If it's a boy, you can kind of talk about circumcisions and how to care for that, and all that information again is in your green sheets. Let's see what else. Just talk about regular bathing. You know, they don't need a bath every day, but if it's hot, warm, sweaty months and their baby's sweaty, they can bathe every day. Otherwise, they can do it every other day. If the baby has really dry skin, you can wait longer in between bathing and use lotions. Make sure you explain to them that they should use lotions that are not like heavily perfumed, or that will be irritating, and don't use oils because that can plug the pores too. So, and don't use powders. Teach the parents. You know, some parents are used to just using a lot of powder and they'll put a bunch on there. The babies breathe in all that silica and it gets into their lungs and can be really irritating and cause problems. So, discourage use of powder. Let's see. I think that's it for now. Oh, and then talk about safety with the baby. So we talked about water temperature, but never turn your back on the baby. If you're going to do something or grab something, always have your hand on it. You would not believe that these babies will move and they will fall off if you have them on the kitchen counter or have them somewhere, or even on a changing table. They will move and they will fall off. So you cannot teach them to never turn their back on the baby. Always have their hand on them if they're reaching for something or doing something. Okay, so we'll start. So we've gotten our warm water, we've tested it, it's nice and warm. When we start with the head, we don't use soap. And put gloves on. If this is the initial bath especially, they're still all goopy, bloody from delivery. A lot of the times the baths we're doing are the first bath, so they're so goopy. They may not look so much because they get a lot of it wiped off, but they're gross. So you'll get that wet, and you'll just, no soap on the head and the face. Well, on the face, I should say. So you will start with our head, and you'll take a corner of the washcloth, and you'll go from inner canthus of the eye to outer canthus, and wipe that. Then change to a different part of the washcloth for the other one, because you don't want to spread infection from one eye to the other. Inner canthus to outer canthus. You did that. Then you can soak it, squeeze it, whatever. And then you're just going to clean around the face. You might need a little bit of force to get some of that off, okay? Get under the neck, and they have all these folds. You have to get, don't just wipe like this. You have to get into all their folds, So get into the neck, the ears, they get stuff behind their ears, inside their ears. Use different parts of the washcloth. Feel free to put it in, get it wet and wring it out. Get their ears clean. And then we will save the head. We're going to do the head last, the hair last. Okay, so then we'll put a little bit of soap in here, get it soapy, and we will move down to the chest. And we dried too, as I was doing that. Sorry, here's my drying towel. So I dried their face. Now we're moving on to the upper body. So we'll do one arm, get in the armpit, gunky little areas, their hands, all in those little crevices. Do one arm, dry one arm. Do the other arm, dry the other arm. Get it wet again, squeeze it out. Do the chest. And this is a time when you can kind of explain things to the mom too. You can explain that, you're going to feel the little nipple buds and that's normal, and you can show her that. And then you dry that chest. Okay. And then we're going to flip the baby over. And you always support its head and neck, right? So I do like the jaw like that, flip it over. This is when they usually really start to cry because you're moving them around. And so they turn their head to the side so they can still breathe. Then do the others. Then we'll do the back. Well, people know. So. I do the same. Then we'll do the back. And you know, as you're doing this, you're always looking at the skin, assessing the skin, you're looking at things. This is a great time to really get a good look at the skin and explain things to the mom about the rashes. If the baby has Mongolian spots, like in darker ethnicities, it'll almost look like just a bruised area all along here, or maybe on one side. So you can look at that and explain